And welcome to the Virginia Dental Hygienist Association Town Hall. My name is Tracy Martin. I am past president of VDHA and I am advocacy co-chair. I want to welcome you all to this exciting webinar tonight to give you some information. It's going to be a fact-filled webinar of VDHA's advocacy efforts and what you can do to help in the upcoming 2026 General Assembly. I'd like to welcome everyone. We have such a diverse audience tonight. We have our dental hygiene colleagues from all around the country. We have dental hygiene educators. We have dental hygiene students. We actually have some dentists, some members of some stakeholder organizations, and we actually have a few concerned citizens. So I'm very excited to get this information out to everyone. I'd like to introduce the VDHA advocacy team. We have our co-chair, Kristen Robbins. She is past president. We have our chair of the Public Health, Education, and Public Affairs Council, Kathy Berard. She's also past president. We have Marlene Rhodes, who is our president-elect. And we have our current president, Derek Sven. I'd like to go ahead and introduce Derek. He's going to bring some greetings, but also, actually, let me take that back. I'm going to do a little housekeeping. We are in webinar form tonight, so that means that the chat is disabled. So attendees will not be able to chat with one another. What we're going to do is go ahead and do a presentation, and then at the end, we will do a Q&A session. But throughout the presentation, you can type your questions in the Q&A. If you pull up your Zoom settings or the bar on the lower portion of your Zoom, there's a Q&A section. Go ahead and type your questions in there. Panelists will be monitoring the questions. If the questions are going to be answered at a later time in the presentation, we will let you know by typing the panelist chooses to answer this live. We will have our panelists read the questions at the end to Barrett, our presenter, and the Q&A is not live. Barrett will answer questions at the end, and we will either type the answers or Barrett will answer those live. Everyone will be muted. And let's see, what else? I think that's it for housekeeping. Again, we want to welcome everybody. And I'm going to go ahead and bring Derek up to bring some greetings.
Thank you, everyone. I am Derek, the current president of Virginia's Dental Hygienists Association. Thank you so much for attending this town hall meeting. It is my great pleasure to introduce to all of you our lobbyist, Barrett Hardiman. He is the lobbyist for Virginia's Dental Hygienists Association and will be championing the legislation that we will be introducing this year. And with that, I'm going to turn it over to you, Barrett.
Thank you, Derek. I really appreciate it. I am going to take a quick second to share my screen so that you all can see the presentation. And then I will introduce myself to everyone. Well, thank you again, Derek and Tracy and everyone else. My name is Barrett Hardiman. I am your lobbyist. Just by way of background on myself, I have been a lobbyist for about 22 years, 23 years. Sometimes it's hard to remember when exactly my first session was. Worked with a number of different trade associations, have worked at companies and done multi-state lobbying, started my own lobbying firm just over 6 years ago, focused on Virginia and politics here in Virginia. And I'm really excited to be working with you all this session. I'm going to run through these slides and look forward to your questions. I'm going to try and keep things as brief as possible with giving you as much information as you will need to move forward prior to session, to hopefully talking to your legislators, and then during session, and then encourage you all to join us at our Advocacy Day on January 23rd. So first, kind of want to frame the situation that we're dealing with politically right now. As you all know, there is a gap in the workforce for dental hygienists, about 1,000 spots that need to be filled. Right now, we have around 5,300 licensed practicing hygienists, but around 800 who are inactive but still licensed who have left the workforce. And I'm sure you all have seen the study. It was a joint study between ADA and ADHA in 2024 that listed the lack of upward mobility and workplace conditions as a couple of the top two reasons that hygienists were leaving the workforce. What we want to impress upon our legislators and the community is that there's not a shortage of dental hygienists, there is a retention issue. There are nearly enough hygienists to fill who are inactive to fill the spots that are currently available. But we need to take the steps to bring them back into the workforce so that they can take those jobs and start to relieve the pressure on the work that you all are doing, the work that the dentists are doing, and avoid some of the policy decisions that we're trying to keep the legislators from making to backfill those roles with folks who might not be as qualified for the job. One thing that I want to note that we and VDA are going to be standing shoulder to shoulder on and advocating with the General Assembly is that we need more funding for dental hygiene programs in the Commonwealth through the community college system, through VCU School of Dentistry. Specifically, and speaking with the VDA, they are going to be looking for budget amendments to increase or beef up the dental hygiene program that correlates with VCU's dental school expansion. And then also trying to restart the dental hygiene program at the Peninsula Community College. Again, these are something that we completely agree on. We need to increase the education. We need to bring more people into the industry and make sure that they're getting trained in proper programs and licensed through the state in the way that all of you were. So we are going to have a VDHA piece of legislation this year. And it's a big piece of legislation, and it's the first time that a lot of legislators will be seeing this. So we have a lot of education to do. There are a few things that the bill does. It creates a Board of Dental Hygiene, and which would allow you all to have regulatory control over yourselves. And this is important because when your profession started, there was not professional training. There was not, and the licensure has been with the Board of Dentistry since its inception. You all are professionals and should regulate yourselves. You are one of the few, if not the only, profession in Virginia where you have to have education, licensure, and continuing education, where you are not given self-governance. Realtors have self-governance. Nurses have self-governance. Cosmetologists have self-governance. You all deserve the same respect in your industry. So there are a couple of primary things that the bill does. Again, creating the Board of Dental Hygiene, which would move you out from the Board of Dentistry and establish your own board, which is primarily has dental hygienists on the board. It would also have a dentist on the board and a dental hygiene educator on the board. It would be a slightly smaller board than what the Board of Dentistry is, but would be large enough that it would be able to pull hygienists from multiple parts of the state so that there would be a variety of perspectives. The other thing that the bill does is it makes a couple of tweaks under general supervision and remote supervision, essentially trying to remove a lot of those strains on the industry that require the dentist to be present constantly, to prescribe what you all need to do, and under remote supervision, for you all to have to get a waiver signed saying that you understand there's a risk that there's a dentist that the dentist is not there, when really there isn't a risk because the dentist is not there, because again, you are trained health professionals taking care of your patients. Um, what we really want to impress upon the legislature with these changes is that while dental hygiene and dentistry are related professions, they are two distinct disciplines. Dental hygiene is not a subset of dentistry. It is its own profession. You all deserve the respect from the state to self-regulate, and the self-regulation will allow you as the trainees or as the trained hygienist to preserve the integrity of your industry by giving you the oversight and ensuring that any new change in scope for other folks who work in the dental industry is reviewed in a way that is through the lens that that you all have to ensure patient protection. We also hope that the change in oversight will somewhat change the conditions in the workforce by making the conversations between the dental hygienist and the dentist be more of a conversation between two professionals versus just seen as an employer and employee. What I do want to make sure we all know is that this is not an autonomy bill. I know that there are a lot of folks who are saying out there, and I think that there are maybe some other states who are looking at hygienist autonomy, and that is something that we have discussed. Virginia likes to move things slowly along, so we didn't want to go for autonomy in the first year bringing this bill. So we thought reducing some of the restrictions, creating a board of dental hygiene would be a couple of really good first steps to show the state that we do deserve the respect that they should be showing us. So I want to make sure we kind of strike the word autonomy from our vocabulary right now, so we're not using that with the legislators, because that's what they're hearing, is that we are bringing a bill that's going to create autonomy, and that's not at all what we're doing. So I also want to talk to you about the Virginia Dental Association's legislation. And I also want to note we have not seen the drafts of this legislation yet, either bills that they're bringing forward, so we can't say exactly what those bills are going to have in them. I have had a conversation with the executive director of VDA and have a good idea of what they're bringing forward. But again, until we see exact language, we don't know exactly what the legislation will be. But they are both following model legislation that has come from ADA, and the first one of those, and I think the one that we're probably the most concerned about, is the scaling assistant, which would allow dental assistants to perform scaling and other duties that would usually be reserved for a licensed hygienist. Obviously, you all know that supragingival scaling is not complete preventive care. It would create a situation where you would have someone doing half of the work before the dentist would have to, or the hygienist really would even have to come in and do the second half of the work. So it's not creating any efficiencies in the workplace. It also is dangerous for the patient. So we want to look at this through the lens of patient protection and ensuring that they're getting the best care that they possibly can. On-the-job training, which is what this bill, as we understand it, would contemplate, does not provide full training. It does not give a dental assistant the same skills and competencies that you all have gotten through your education. And it does not put them through any kind of clinical trial to determine that they are actually capable of doing the work. And so you would have untrained dental assistants working on patients while being supervised by either a hygienist or a dentist, but really kind of making mistakes and learning as they go. And again, not really creating efficiencies in the workplace, because you are taking professionals and having them have to train someone as they're doing the work and learning as they come along. And the final thing is this creates an unlicensed category of healthcare professional, which would create some risk additionally for the patients in the event that something happened. You could have a situation where there's action taken against the dentist, but the dentist didn't perform the work. So we want to make sure that in any case that the patient has all of their rights when they're receiving the care from their dental professional. The second piece of legislation that we know is coming is that would allow for an accelerated path to licensure for dental hygiene for foreign trained dentists. Again, go back to the point earlier with our own legislation is that preventive care and restorative care are not the same thing. And in a lot of cases, dental programs, international dental programs don't train in preventive care. And we really just don't have an understanding of all of the international dental training programs that are out there. So we wouldn't want to see an accelerated path because we don't know what the skills and competencies of those foreign trained dentists are. We would want to ensure that they have gotten the preventive care training and have been tested to ensure that they can perform those practices. So again, this is one that we know is coming. We are concerned about, and we're letting the legislators know that we feel like providing an accelerated path is again not going to close any gap in the workforce. The quickest way to close that gap is to get the dental hygienists who have left the industry to come back into the industry versus trying to shortcut the education program for dental hygienists. So looking forward to your questions about the actual substance of the bills and what's coming up. But also want to talk a little bit about how to talk to your legislator. There are a handful of ways that you can get in touch with your legislator, and some are more effective than others. The most effective way to talk to your legislator is with a scheduled in-person visit, either in your district or at their office. They all have district offices. And they are happy to meet with you in their offices. That is the best way to do it because that's when you have the most time. They are not rushed during session. You can usually get half an hour to maybe even an hour to sit down with them or do a Zoom call with them. It is really effective and it gives them the most chance to ask you questions, learn about the issues that you're bringing to them, and also for them to get to know us and understand the difference between the Hygienist Association and how we work with the Dental Association, and then what the differences in the two professions are. Second best way to do it is to just show up at the General Assembly and either try to schedule a meeting with your legislator, or you can pop into their office. It's totally fine to walk up to your legislator's office and talk to the administrative assistant who sits out there and say, "Hey, I'm a constituent. I would love to see the legislator if they're here." If not, a lot of times you'll get to talk with the legislative assistant, and that is almost as good as talking to the legislator. Those folks are very smart. They know what's going on. And every single piece of information that they receive, whether it's in person or from email or elsewhere, goes into a binder that they put with the legislators when they're looking at the different pieces of legislation that you're talking to them about. But showing up in person really shows a lot of commitment to the legislators. They really respect it, and they appreciate you showing up. Schedules are crazy during the General Assembly session, so you may have something scheduled and not get to see them. It's not because they're snubbing you. It's just because they are very busy people. They have 60 days to get nearly 3,000 bills passed or killed. So there's a lot of work for them to do, and it is very effective to show up and try to talk to your legislator. Next best way is through email. That way there is a easy record that those legislative assistants can take, and they can pop into those binders for the legislators. They have something for them to read. Makes it really clear what you are talking about, and it's less work for them, so it makes it easier to get your message to the legislator. Next, a phone call to the legislative office. Again, you're going to end up probably talking to a legislative assistant or possibly even the administrative assistant who will work with them during session. But those phone calls do get tracked, and even if it's just a phone call to say, "Hey, I support this bill," and give them the bill number, they will be tallying those up and taking that into account. Mail is not a great way. You can still send a piece of mail. Mail is not a great way to get in touch with them because it is a little bit slower. It won't arrive potentially until after a committee hearing happens. Things can move very quickly down there. So I wouldn't go with mail, but if you want to send somebody a letter, go ahead and send it now and send it to their capital address so it'll be there waiting for them. Social media is the last way to get in touch. One of the last ways to get in touch with your legislator. Some of them check them, some of them don't. It is not the best way. If it is your last resort, then reach out via social media, private message if you can. But generally speaking, posting on something, on their timeline about something that's happened or commenting is going to get lost in in the fray with everyone who's out there, and it's really difficult to determine who's a constituent and who's not. Also, want to know you can talk to other legislators who are not your legislator. If you're not a constituent, totally fine to go talk to other legislators as a representative of your industry, as someone who's a member of the BDHA. We are all in this together, and they're not going to turn you away just because you're not a constituent. So it is most impactful when you talk to your own legislator, but you should feel absolutely free to talk to other legislators as well. If you don't know who your legislator is, the General Assembly provides a really easy way to find out who they are. It's Who's My Legislator, the website. The link is down there at the bottom of the page. It is very easy. You just put your address into it, and it will tell you who your House of Delegates member is, who your senator is, and then also who your federal congressperson is. Probably, I think it also gives you your local legislators. It's a very useful tool, and if you are looking to figure out who you need to talk to, that is the place to go to look for that. So a couple of tips when you're actually talking to your legislator. It's a good idea to do a little research on them to understand, what their background is. There are a couple of legislators up there who have worked in dental offices. One legislator whose dad and brother are dentists. One who is a pediatric dentist. So there are people who have some experience in the industry. But it's always just good to kind of know who they are and who you're talking to and what level of understanding they have of the industry. And that's kind of where I always start with the legislator when I'm talking to them fresh about an issue, is to say, what do you know about what we're doing here, what we're talking about? It's just a good idea to kind of level set and understand what they've heard already, and then that gives you the ability to kind of come in and either reinforce good things that they've heard, or rebut some things that might not be not necessarily exactly true, but might not show the full picture. The most important thing you can do, though, is talk about why the issue is important to you, whether it is a professional concern, a personal concern. It is really important to share that personal side. I, as a lobbyist, am there kind of presenting the desires of the entire association. They know that I'm a paid lobbyist and I'm there representing you, that I've spent decades building relationships down there, so they will trust me. But for you to come in and say, this is something that's personal to me, it means a lot to me, and your support on this would mean a lot to me, is really, really important to them. And they take that very serious. And the personal stories are what make the biggest impact when talking with your legislators. Another really important thing is to actually make the ask. And that is something that a lot of folks forget to do. You have this great conversation with the legislator. You may get 30 seconds, you may get 15 minutes. And at the end of it, if you don't say, I need you to do this, please, or I need you to vote against this, please, they will not know what you're there asking them to do. So you need to actually say to them, I want your support on House Bill, whatever the number is, or I would like you to vote against House Bill, whatever the number is. That ask is incredibly important. So make sure that you do that. And then always follow up with a thank you, always be polite. Couple of things that, I know you all would probably know better than to do, but always want to make sure that we say it is, never tell a legislator, you work for me or I pay your salary or anything like that. That does not go over well. They know that they are public employees and that they are there to serve you. But it really does not go over well with them when you take a kind of a condescending tone with them. So always be grateful. Always be thankful for their time, for what they're doing, and thanking them for their service to the Commonwealth, because it's a hard job. It is, it's a part-time job technically, but really it's 3 full-time jobs that they have to do in addition to being regular citizens and having their own jobs to be able to feed their families. So with that said, we really hope that you join us for our Advocacy Day on January 23rd. We will meet in House Room 3, which is in the basement extension of the Capitol, at 8 o'clock in the morning. And from there, we will kind of get everybody ready and then send you out to talk to your legislators. And just a heads up, that is a Friday. So generally speaking, they kind of head out of town right after the legislative session is over. There are usually a couple of committee meetings that meet after that, but you want to get out there and try to catch them before they head into session. Um, and then also encourage you to visit the VDHA website. There's a lot of good information there. And the last thing that I will say that's really important when you're talking to your legislator is to remember this one thing, and that is that they are just people. They, there a lot of times you come in and it seems very intimidating. It's a big, beautiful building, and these folks are, seem like they have this tremendous amount of power, but really they're just human beings. They're trying to do their best. They are dealing with so many different issues on a daily basis that they cannot be experts in everything. So they do rely on you for that information. But ultimately, they're humans, and you can talk to them just like any other person that you would talk to. So I will stop there, and I see that there are a bunch of questions in the chat. And see if there's anything else that the other panelists want to add as well.
Thank you, Barrett. I'm going to go ahead and turn the Q&A over to our President-elect Marlene Rhodes and our PEPA Council Chair Kathy Berard. So if you guys could just read the questions for Barrett, or if you've already answered, I think it would be a good thing for everyone to hear the questions.
Absolutely.
All right.
Absolutely. So I answered some and Kathy answered some. So we had an anonymous attendee say that we need a uniform presentation for contacting the legislators. We need to reach all of them to turn down the proposal by VDA. Kathy responded to that. Kathy, would you like to tell them what you had said to that one?
Yes, if you are not an ADHA member, please give us your emails. You can go ahead and put them into the Q&A, and we'll get you. We just need, because ADHA has this thing called Voter Voice, and they already sent it to me. I've already sent my letter to Senator Boysko and Delegate Shin. They already know where I live. So the letter's already beautifully written, and then I just added a paragraph about myself. So the letters are ready to go, and ADHA has that for us. But we need to know where you live, because where you live dictates who your senator and your delegates are. So if you are not a member of ADHA, we'll just need your email so that we can contact you and get your addresses so that we can help you with that. Does that make sense?
Mm-hmm. And Kathy, I just wanted to let you know we have all of the attendees' emails when they've registered for this. So if you are on the call, we have your information today, which is great. But
we know who if they're members for ADHA.
We can find that out. Yeah.
Okay.
Yeah.
All right. Good. And then the next one, let's see the answered ones.
The next one was what do we know? And this was going to be answered by you guys. What do we know about why licensed hygienists are inactive? What changes are needed to bring enough of them back into practice to meet the demand?
So I do know that Virginia Dental Hygienist Association Foundation is planning a survey of hygienists that are licensed. We have the list of all the licensed hygienists. The problem is that the ones who are not actively working, that's a separate list that the Board of Dentistry controls. So we'll have to send the survey to everyone. And people need to answer. When you get the survey from us, you're going to need to answer so that we can get the answers to that. Some people are retired. They may be retired because their hands are having trouble. That might be why, but they're still keeping their license. And some people, there are other reasons that they're just not working, but we don't know. We know that a lot of hygienists have sadly had I'm not going to sorry, I'll take it back. I'll take that back.
Kathy, I'll go ahead and add to that. There's been 3 different studies that have come out are showing exactly the reasons why hygienists are leaving the field. The first was done by ADHA and ADA jointly, and the root causes were burnout and high turnover during the pandemic. We all know about that. The other leading cause was toxic or unsupportive workplace cultures, and that is something that has to change. And the third element was limited career advancement and professional stagnation. That also needs to change. Just this year, another study came out from Wedding et al. It also showed that more than half of hygienists reported workplace bullying and sabotage in their work. That also has to change. The profession needs to be respected as the distinct profession it is. It is not the same as dentistry. We are the prevention specialists in dentistry. The third one actually came out in 2018, and it was an ODU study that predicted the exact problems we are experiencing today, showing again that culture and workplace sabotage and disrespect to professionals were the leading cause of why hygienists are leaving the field. So yes, we do know the reasons. We have to come up with solutions to fix those issues, not replace hygienists with minimally trained individuals off the street.
Okay, so the next question was, what is the ADA plan for training for these non-licensed possible RDHs? 1 day, 1 week, 1 month, a certificate? Will it need to be disclosed to the patients? And Kathy answered that. Would you like to answer it for everyone else at this time?
Yes, so the ADA model is the one that VDA has proposed, and it would be 120 hours, which is 3 weeks of training, 120 hours, 40-hour week, that's 3 weeks. The dental assistant must have worked for 1,800 hours in that office in the past year, and that VDA would own the training that would be done, that they would approve and provide the type of training that's being done. That's what they have revealed. That's how Missouri does it. And the Missouri Dental Association is a proprietary training program for the assistants. That's what they have spoken about doing. Again, as Barrett told you, we don't know what exactly the legislation looks like, and we don't know if the legislation will exactly spell all of that out. And in all fairness, they should reveal to the patient that they're being cared for by someone who's not licensed.
Okay, so the open questions, has there been any talk about creating reciprocity between the states? This may decrease the non-practicing licensed hygienist statistic. Derek?
I'm sorry, I was reading a different question.
Sorry, about reciprocity between the states, and that may decrease the non-practicing licensed RDH statistic.
That is something that is being held at the national level. That's Virginia already passed the compact. Right now, it's working through the details on it.
Right.
I don't really see the compact as being the solution to this issue, though. It's a tool to help bring in hygienists from other states quickly and easily, but that's not going to solve the issue in any meaningful way, in my opinion.
Okay, next question. This person, Stephanie Gardner, said, "Thank you for hosting the Zoom tonight. My question is, what is the verbiage that the legislator will connect with? Key or hot button words? Also, what is the suggestion for what to say during a comparison of dentist, dental hygienist, and the liability of a dental assistant?" Derek?
I think, again,
Barrett?
we're really talking about, the respect for the industry, as Derek mentioned. It is not a subset of dentistry. It is its own profession, and it is distinct from dentistry. And the legislators that I've been talking with understand that, and understand that we are still operating, or you are still operating under a system that was established a long time ago and is very archaic. So it is time for you to have your own board. I think, one of the challenges that we face with that is that it's going to cost some money to set that board up. And the budget is pretty tight this year, but we will try to work through that. I think in terms of, the VDA bills and what we need to say, the most important thing to focus on is the patient safety, and that, we are dealing with, and I have to admit, I stole this from ADHA from a call that they had the other night, but it's a retention issue. It's not a workforce issue. We are trying to bring folks back into the workforce, and that we want to make sure that anyone who is performing the services of a dental hygienist has gotten the appropriate training and the appropriate licensure, and is accountable to the patients and the state. So that's really what we're looking at here.
I'm going to take Dana's question here. This one actually is really pertinent. This one is, in terms of speaking with legislators, is it frowned upon to mention the enormous pressure for dentists and the declining reimbursements from insurance, and how this affects the dentist-dental hygienist relationships in terms of production? Yes, that is the elephant in the room. We would not even be having this discussion if insurances were actually paying the way they're supposed to be. There has not been a meaningful increase in insurance in 20 years. If there were not the economic pressures being placed on dentists and hygienists that are really boiling down to the unethical production demands that are being placed on clinicians, we wouldn't be having this conversation. There would be hygienists happy to work in the field because there wouldn't be the workplace sabotage and ethical dilemmas they're continuously being placed under because of those economic pressures. So yes, that is a major issue that should be being addressed by the Dental Association. But instead of addressing those insurance issues, they're choosing to downgrade the workforce to supply for that economic issue that they're dealing with. And that's unconscionable.
Okay, so let's there is a where are the template letters that we can email and flood our legislators with? Will we have a fact sheet on Rally Day? I would love to answer that question myself. The letters I will let Kathy or Derek speak to, but the fact sheet on Rally Day, yes, everyone will have fact sheets not only for yourself. You will have fact sheets to pass out to each of the legislators that you contact, as well as you will probably, if we have enough printed, which I'm sure we will, have some to take with you in order to contact your legislator at a separate time and or to pass along to your fellow hygienists within your office. And the template letters, Kathy.
And the template letters, we'll send them out. We'll send out template letters after this session here tonight. We'll send that out with the other material that we're going to be emailing to all of you. So you'll have an email version of the letter, and then, but we'd also like you to all get onto the voter voice, because that one will automatically go straight to your senator and your delegate.
And it won't just be a template letter. We have some really cool tools that allow you to use artificial intelligence to help you with that and really speed the process up and make things more customized. So yes, check your inboxes. Some really cool things will be coming your way.
Yeah, it makes you look like really out. I mean, Derek helped me do it. It's amazing what it makes your letter look like.
I'd love to address Sharon Stoll's question. Who are sponsoring the bill? Is it a House bill or a Senate bill? What specific number is the bill? I'm actually going to throw that question to Barrett.
Okay. Yeah, so we have both bills are being drafted in both the House and Senate. We have not secured patrons for those yet. I am working on that. It is my top priority every day to try and find a legislator who will carry those. Like I mentioned, there are some legislators and new legislators who are coming in who have dental office experience. So I am working with them to try and find someone, and I'm going to provide a list to the association so that we can have constituents of our primary targets for bill patrons, so that we can have constituents reach out to them and encourage them to carry it as well. And even once we have a patron and the bills get submitted, it is likely that it won't be we won't have a bill number until like first week of session probably. We haven't gotten the drafts for the legislation back from the Department of Legislative Services yet.
Mm-hmm.
I'm going to take Jacqueline Moran's question too. She mentioned, I was under the impression that there was also a shortage of trained dental assistants. So how could this proposal be practical? Jacqueline, you are 100% correct. That is the underlying crux of the issue. This is an absurd proposal on face value. With a documented shortage of dental assistants, saying you're going to supply the difference between hygienists who are not in the field with those same assistants who are also burnt out and in short supply is on face value ridiculous. You're correct.
Okay. So I have some emails that list that I am copying, so we make sure that you get the information that you need. Where can I get a purple scarf for Rally Day? Tracy, I'm gonna
Register,
take that one.
register for Rally Day.
Exactly. I'm going to be going over next steps at the end of the webinar, but definitely you will be provided a purple scarf upon arrival in Richmond at the Capitol. So everything you need is going to be provided for you. We'll have a short meeting at the beginning of the day. We'll give you exact instructions, send you off to talk with your legislators, bring you back. We'll all be announced and introduced in both the Senate and the House chambers in opening ceremonies. And we will be taking a lovely picture in front of the Capitol, weather permitting, just like you see on the screen now.
Two other questions I'm just going to jump in here and answer real quick too, so we get them out of the way. One is, why are the hygiene programs still not accepting more students? I still hear many candidates apply, but schools still take less. How can we open more schools? The business of
Funding,
education
baby.
is a complicated subject. Many of these schools are held under the umbrella of community and technical colleges. And very often in these arenas, they don't get enough funding for a dental hygiene program, which is very expensive to run. And so it makes it very problematic to open up more schools without additional funding. This is why we will be joining with VDA and making sure that we ask for as much funding as possible for these schools. But I will caution that historically there are times in which there are a surplus of hygienists. So opening up too many programs without addressing the retention issue and bringing back already licensed and trained hygienists can also be a gamble. You have too many people glutting the workforce, you'll have an issue like we had 10, 15 years ago when there were too many hygienists and they couldn't even find jobs. So there has to be a careful balancing act between what is possible and what is practical. There's a second question on here about other mid-level providers, including dental therapists. No, dental therapists are not part of our, it's not our profession. That is a separate, distinct association with its own code of accreditation standards. The Dental Hygiene Association does not have, we are not looking to bring dental therapists to Virginia at this time. And dental therapists do not always have dental hygiene as their baseline for becoming dental therapists. That depends on the way the structure is set up. So there's a little bit of a more nuanced question. It could happen in the future, but career laddering needs to be established more distinctly for that to be built upon. Tracy, I'll hand it back to you.
May I?
Absolutely.
Okay, so the proposal is an anonymous attendee said the proposal is 2 people will get trained on 1 patient. The assistant will scale above the gum line and the hygienist will then come in, probe and scale below the gum line. Question. How does that save any time or money for the dentist, especially since reimbursement by insurance is cutting it so close in the first place, where they're paying 2 people to work on 1 patient? Derek?
Well, VDA has not put out all of the elements of their proposal, but what we have heard is that they are going to allow hygienists to supervise these scaling assistants. In theory, they're not really saying who's going to come in and check or do this work. The broad idea of the scaling assistant is that they're just going to be able to scale above the gum line. That is incomplete care. It's not a billable procedure if it's left that way. It opens the door for serious legal consequences for dentists who are billing for this procedure if there is not supra and subgingival scaling on every patient. That is, by definition, an incomplete procedure that cannot be billed for ethically or legally. So it does create a very serious issue the Dental Association is going to need to work through. But we haven't seen all the details on their legislation yet.
Kathy, can you read a question or two?
Yes, I'm happy to. I was looking at the the one about the dental, why are they not accepting more hygienists into the programs? And part of it is faculty. Okay, and the Virginia Peninsula, which was Thomas Nelson, that school was put on a pause. They paused they were having trouble with their quota accreditation, and we are anxious to get that program reopened. They are looking at partnering with either another community college or another university. This is a big plan that we want to see happen because that program produced excellent hygienists. They've got a clinic sitting there empty. It's just sitting there empty, and it would be wonderful to get it back up going again. The limit for the hygiene programs is the size of their clinics and then the size of their faculty. So the number of faculty that they have per student is a limiting factor. And usually it depends on how many students sadly do not graduate. Their attrition rate, we usually have about 150 students graduating. Old Dominion made their class size larger. VCU made their class size larger. Northern Virginia Community College made their class size larger. So all of the programs are working on getting the class sizes larger. Part of it has to do with the size of their clinics. We can get Virginia Peninsula back open. There's there's a program opening. Fortis College will be opening in Richmond, probably 2027, early 2027. So there will be more graduates then. The interesting thing about the graduates and how many are licensed in Virginia, that about, I did the math on this, it's about 80% of the hygienists that are in Virginia that are licensed came from community colleges or from in-state colleges. The rest of the hygienists are from other states. Like me, I came here from Michigan. I moved here 40 years ago, and here I still am. So you got advantage of University of Michigan here.
Mm-hmm.
So I've got an interesting one by an anonymous attendee. It says, with so many dentists doing their own hygiene, I believe they are capable of training the right person to scale teeth. Probably even better than the instructor at the DH program, who rarely scales teeth themselves.
So there's two different verbs that individual just uses, probably and maybe and could have. That is all left to chance. Dentists do not receive the same uniform training that hygienists receive in periodontal assessment or non-surgical periodontal therapy. And that has been proven in numerous studies, which, if you've read some of the articles we published this year, are well documented. So just taking to chance that a dentist might have received adequate training and they might be training somebody else correctly is a danger to the public. And insulting the dental hygiene program instructor in that same question is a little bit dismissive.
Thank you, Derek. I would like to comment too. We have another comment on that there is a shortage of hygiene educators due to the wage gap. Educators make much less than clinical hygienists, which makes it difficult to convince hygienists to work in education to be able to expand the programs. So thank you for that.
And I wanted to add about the budget climate. This one is, what is your approach to achieving investment in dental hygiene education and training in the current state budget climate this session? One thing that happened with the One Big Beautiful Bill, each state got, I always forget if it's 50 billion. It's a lot of money. And a big chunk of the money that is coming to Virginia is for VCCS is included in that, and the allied dental programs are included in that. And then Virginia also applied for the Rural Health Transformation Project, which is an additional specific amount of money. And DMAS wrote a beautiful, DMAS is the Department of Medical Assistance Services. They wrote a beautiful proposal. So it's like 60 pages of investing that money so that we're looking at the rural areas that need. There's only one dental hygiene program school west of Roanoke, and that's Westfield Community College, and they need programs out there as well.
Absolutely. I also wanted to let everyone know that VDHA will be supporting the legislation that VDA is bringing forward to support a budget increase for the community college programs. So we will definitely be supporting VDA in getting more funding for the dental hygiene programs in the state.
Tracy, I did see one question in there about bringing a prop to talk with your legislator, and so just of note, signs are not allowed in the General Assembly building, so don't bring a sign with you. And we have talked about bringing some of the scaling tools that you all use to show to just say, do you want to be in the chair with somebody who's on their first day of training and have your teeth scaled with this? I'm going to check to see if we will be able to get those through security. I'm not sure if we will. But just to kind of note to you all, while I said some legislators may have some experience in dental offices, most don't. They may not understand some of the terms that we use in talking. They might not understand what supergingival or subgingival means. So if you have something that you can display to show them exactly what that is, the training that you've received, what you know about oral health and hygiene. I think that is like a great way to show them. But again, some of the things we have to make sure that we can actually get them through security. So I'd hate for you to bring something and then get turned away at the door and say you have to go put this back in your car before you come in.
Exactly, that was my idea. I appreciate that tidbit of advice.
So we have a comment from Denise Kearns, and thank you very much for the comment. It says, let's not forget that we need the knowledge of etiology, systemic issues, medications, microbiology. This is not just about scaling.
We definitely appreciate that
Well,
perspective. And
yes.
one of the priorities of VDHA, I wanted to make sure everyone understands, is that our intention is to bring solutions to this problem. It is a multifaceted problem. It's not going to be solved in 1 year. It's not going to be solved with a lot of money. There's a lot of different issues. It's definitely multifaceted. And we intend to engage in whatever capacity we need to help this problem, because it affects the public that we serve. It affects us as a professional. It affects the education systems, and it affects our dentists' bottom line. And we understand that. Absolutely, we understand that. Are there any other questions?
We're getting a lot of comments about, praising dental hygiene instructors, and we as a panel and as a group and as a profession 100% support all of our hygiene educators. We are behind you and we support you and we think you're fabulous. And that is definitely being a consensus on this question and answer. I do want to bring one thing to your attention really quickly. Derek, you have someone who wanted to say that you are absolutely fabulous and that they now have their hope in the profession has been waning recently, and you have renewed their hope and they're very excited.
Thank you. I really appreciate that. And it takes all of us to lead this profession forward and defend against some of these very regressive measures that are being put against our profession and against the public. So yes, we do need to stand together, and we need to make sure that we are advancing our profession's stance in this arena.
Yeah, and there's one more question here. It was anonymous attendee said, why don't you address the real problem, the massive shortage of hygienists in Virginia? The VDA would not even be proposing these ideas if we had enough hygienists in the state. Currently over 1,000 dental hygiene job openings and graduating 136 a year does not even come close to solving the problem. So I have a couple comments that I want to make. The 1,000 estimate of that many hygiene jobs was created by that idea that we're missing 1,000, looking at HPSAs, there's health provider shortage areas in the southwest part of our state. There are not, even if there were hygienists to take those jobs, there are no dentists in those areas either. They're dental health provider shortage areas. If you look at the map of Virginia, HPSAs, it's a DHPSA. It's an amazing amount of areas that are called dental deserts. There are not even dentists there. Hygienists currently cannot work unless there's a dentist there. So that's a problem. The other concern is that we have in Northern Virginia, we have both the dental hygiene programs and our employment referral. For the past 6 weeks, we have had 0 requests for employment. And normally there's like a couple, we would get dentists contact our employment referral, and they contact the dental hygiene programs for names. 0, no jobs going right now. So I'm not sure where all these 1,000 dental hygiene job openings are. We'd like to know where they are so that we can refer our members to those jobs.
Mm-hmm.
There's another anonymous attendee that said, is there a plan to talk to the public about what hygienists do and what it takes to become licensed? I feel like nursing is well known in their education, which gives them leverage in their professionalism. I still daily have patients ask me if I had to go to school for this. There's a severe lack of public knowledge. Derek, can you speak about your upcoming interview?
Stay tuned once it plays. It will be it will be being recorded on Wednesday, and we'll be dropping the recording as soon as it's available to the public.
So we have advocacy campaigns in the works, and I feel like this might be a good time to number one, be mindful of everyone's time because it is almost 8 o'clock. I'm going to go ahead and wrap things up. Thank you, Barrett, for your time and your expertise and your efforts on behalf of the Virginia Dental Hygienists Association. Thank you, Derek, for your endless work into the wee hours of the evening and night
Yes, I'll be getting on another meeting right after this. And
to steer the train. Yeah.
Since I have to jump off, if anyone has further questions for me, you can contact me at president@yourvdha.com. I'll be happy to answer additional questions.
Okay.
And Tracy, I think because there's still a few questions that we didn't have time to answer, so we can answer them when we send out the recording of today's session. And
absolutely, that was part of my announcement. Yeah. Okay. So what are the next steps? If you are not a member of VDHA, please join. Your dues money pays for our lobby partner and allows us to advocate for every hygienist in the Commonwealth of Virginia, not just our members. We advocate for our profession. Stay plugged in to VDHA and ADHA's social media accounts. Check the website frequently for updates. We have a new website now. It's www.yourvdha.com. And on the screen, there's a QR code. It goes right to the landing page. We have information on all of our leaders, way to contact us if you need anything. There's a button to click to join. That is one of the most important things you can do is stay plugged in, join, and allow us to advocate for you and the rest of the profession. Sign up and attend our rally day, our advocacy day at the Capitol on January 23rd. Please click and share the QR code that you see on the screen now. Take a screenshot, put it on all of your social media accounts. Flood your social media accounts with the information that you gleaned tonight. Your patients, talk with your patients on a daily basis. Help them understand what's happening and what needs to happen. A recording of this webinar will be available on the website. It will be a no charge, but a registered video. So you just have to sign up to get it, and it will be emailed to you. And most importantly, thank you for attending this evening. We appreciate your time, your efforts, your education, and I'd like to also thank the advocacy team at VDHA for their tireless um, efforts and passion. We have some amazing, amazing members and leaders in our organization, and we look forward to meeting all of you on Rally Day. Does anybody else have anything they need to say?
Tracy, we have a person who was asking about attire for Rally Day, and I know that that information is going to be coming out with their registration, but can you clarify that for us?
Absolutely. Our attire typically was either business casual or um, a purple attire, but this year we have made the decision that we need to be uniform in a white lab coat, and we will provide our purple scarves for anybody that attends Rally Day. You can purchase a inexpensive lab coat, a short lab coat. We're not posing as dentists. We don't want to look like dentists. We don't want the legislators to think that we are dentists. We want to distinguish ourselves with a shorter lab coat similar to the jackets that we wear to see our patients, and then we will provide you with a white scarf. So white jackets
Purple scarf.
and purple scarf.
Because we want to make the clear message that we are licensed, educated professionals who deserve parity and respect in our profession.
Our grassroots efforts are underway. We will be giving out the information and the templates for the letters to the legislators as soon as the definitive information comes in, as soon as we have bill numbers, as soon as we have the language of the legislation from both VDA and VDHA. So stay tuned, stay plugged in. Thank you for your time. And we will also be sending you a follow-up email with resources that you can use, as well as the talking points and the fact sheet for Rally Day. So have a great evening. Thank you for taking time out of your holiday schedule. I know it's busy. We appreciate all of you, and have a great night.
Thank you all.
Thank you.
I think, they're all.